Good evening and welcome to Visiting Nurse and Hospice Care's Annual PHORUM, Perspectives in Healthcare. I'm Rick Keith, Executive Director of the Foundation for Visiting Nurse and Hospice Care, and on behalf of the entire board, our staff, and volunteers, thank you for joining us tonight. Let me start the evening by thanking again the Roki Foundation for their incredible sponsorship to make this possible tonight, this year's forum. Thank you to the Roki Foundation. The theme of this year's forum is bringing healthcare home, and that's exactly what VNHC does every single day. As we near the conclusion of this day today, our competent and committed caregivers have already helped over 315 patients recover from illness or injury to help them live more independently at home. Today, our compassionate hospice teams of physicians, nurses, counselors, chaplains, and volunteers have provided care, support, and dignity to 160 patients and their families at end of life. Today was no different from most days at our loan closet, as 18 people walked through the doors needing to borrow some basic medical equipment like wheelchairs, walkers, crutches for free. Every day, our mission at Visiting Nurse and Hospice Care is to provide compassionate and trusted care for all. And we're able to fulfill our mission because of the generosity of so many who donate and who volunteer. And many of you are in the room tonight, and we thank you for that. 3 years ago, we started the forum to provide an opportunity for healthcare leaders to discuss issues that impact our community. For the past 2 years, the primary focus has been on the implementation of the Affordable Care Act and how that has affected our healthcare in this community. This year, we're focusing on access to healthcare in Santa Barbara. And to lead us in that effort tonight is Lynda Tanner, President and CEO of Visiting Nurse and Hospice Care. Lynda is a visionary leader who leads our team of more than 500 dedicated staff and volunteers who provide care to more than 12,000 patients and families annually throughout Santa Barbara County. Lynda is passionate about home care, believes it is vital in controlling healthcare costs as our aging population chooses more and more for in-home care. With more than 30 years of experience as a nurse and healthcare administrator, obviously she started when she was 2, Lynda is a respected leader in the home health and hospice industry, both in our state and nationally. So please help me welcome Visiting Nurse and Hospice Care President and CEO, Lynda Tanner.
Thank you, Rick, and thank you all for joining us tonight. I have the honor of serving as the moderator for this year's forum panel. I'm really looking forward to hearing what this incredible and diverse group has to share. But first, I'm delighted to announce the winner of Visiting Nurse and Hospice Care's Community Partner in Excellence Award. Each year, our employees, caregivers, and key stakeholders nominate individuals and organizations who partner with Visiting Nurse to uphold the highest standards in quality patient care. Let's give a warm round of applause for this year's recipient of the Community Partner in Excellence Award, CenCal Health. Now I'd like to ask Bob Freeman and his team to join me here on stage as I share a few tribute messages from our staff who nominated CenCal Health for this award. And I cannot see any of you. Okay. CenCal has been and continues to be a wonderful community partner. They have helped us explore new ways to expand our telehealth program and actively support their own members with assistance during their final stage of life at Serenity House. I'm so grateful to have CenCal as a partner committed to serving the Central Coast so that we can expand our home care service offerings. In 2015, CenCal Health went above and beyond to support our mission to provide care to underprivileged, low-income individuals regardless of their ability to pay, and we are grateful for their continuing support. So I can't say it any better than that. Congratulations, CenCal Health, for all that you do. So we have this wonderful award here for them, and thank you, Bob. Thank you, everybody. So,
All right, thank you. I have
yes, so you're
say a
just
couple of
speak.
words
Absolutely.
for this. First of all, thank you, Lynda and Visiting Nurses, for this award. I mean, as a mission-driven health plan, by the way, it is blinding up here, you can't see that. As a mission-driven health plan, it's nice to get the recognition that what we are doing is having some resonance and having some effect. And when Lynda told us we had the award, I thought, well, you know what I could do is just come up and politely accept the reward and say what I'm going to say. But I also thought it'd be a good idea to give you some idea of kind of what a health plan does and all the moving pieces that all have to function, correctly for everything to work and for us to be so effective. So what I've done is asked some of our staff to come up and share this award, and I just wanted to kind of give you an idea of the different roles we play. We'll start with Jennifer. Jennifer Vo is our assistant counsel. She's in our legal department, and we are a health plan built on contracts. We don't employ anybody ourselves, so we have to contract with doctors and hospitals and pharmacies and so forth. We have over 2,000 contracts that are constantly being amended or revised or new or ended. So we need someone to make sure they conform with all the state and federal requirements, and both parties are well represented, and Jennifer and her department take care of that, and that's a full-time job in itself. Next to Jennifer is Teresa Herzog. She's one of our care management nurses, and if you're healthy, things are great, but a lot of times the sickest of our population really need care coordination. They may have a number of different conditions or what have you, and they need to be guided through all the different aspects of healthcare. And our care management nurses and Teresa are the ones that help guide the ones who really need the most help and make sure they get the care they need when they need it, and are there to help resolve anything if there is a problem. And next to, we've got, who's that? Ariana, I'm sorry. You guys but anyway, you're sisters, right? Ariana's in our provider services department. So those 2,000 contracts are connected with 2,000 different providers that we have in our 2 counties. And provider services make sure they are, everything is functioning well at all those different offices and all those different hospitals. And home health and so forth, to make sure that the people that are seeing Medi-Cal continue to do so. I think I've heard that we don't, let me see, what is it? We don't pay great, but we pay well, which means what we do pay, we do on time, we do correctly, and I'll get to Cody in a minute. But there's a lot of, I think we're the only health plan in the area that actually goes to provider offices, and really, we have relationships with our physicians and with our other providers, and that's Provider Services Department. And then, so member services, we get about 10,000 calls a month and again, we're just the 2 counties. People they have questions, am I eligible? I have a problem getting an appointment. I have this issue or that issue. I want this drug, or I have this complaint, or however you want to say it. And so member services, they answer these calls, 90% of them within 30 seconds, and they are great at helping people walk through the maze that can be healthcare and making sure they have a voice and they have a sympathetic ear on the other side of the phone, and making sure their problems get resolved, and actually serve as an advocate for our membership. And then we get to Cody. Cody is in our claims supervisor department. Claims supervisor in our claims department. And what claims does is we pay about 170,000 claims a month, so about 2 million claims a year that come in from doctors and hospitals and everybody. And they have to be correct, they have to meet state guidelines, they have to, all the different requirements in there. And they have to have, I don't even understand it, modifiers and exception codes and this and that. So Cody and his team make sure that the approximately $600 million a year we do pay out is paid correctly and timely, and everybody gets their reimbursement quickly and accurately. And then Lauren is in our, she's a quality management specialist. And healthcare is built on data, and that's how we determine everything. And Lauren and her folks, they go and collect the data. So we know what our members need, what we can encourage providers to help them get, and you get the health status. So Lauren and her people, through record collection, analysis, 97% of our pediatric members got their polio vaccines on time, 96% got their measles vaccine on time, 97% of our 1 and 2 year old members have made sure they got to see their doctor. So we can see that data that's collected and really help chart the course of our membership. And then finally, Karen Fish is our HR director, and I will say that when she comes in my office and closes the door, I just kind of go, oh, God. But usually it's not the case. And Karen, and we have about 170 employees, and we're growing rapidly, and we really strive to be an employer of choice. We want people to want to work for us, and we want them to share our mission and vision and values. And Karen makes sure that we're as well-functioning in the personnel department as possible, and everybody's as happy as they can be. So with that, I'll thank you again, and we get on to the rest of the program. But I really accept this award on behalf of not only the employees, but our providers as well. So thank you very much.